friends. I'm Dr. Malia Jones. I am a social infectious disease epidemiologist and the former editor-in-chief here at Dear Pandemic. And I am super excited because we're back today with a special live Q&A to discuss the vaccines for kids ages 5 to 11, which were authorized by the FDA and recommended by CDC this past week in the United States. And I get to talk with 3 of my very favorite nerdy girls. And we have a really cool range of different expertise today. We are joined by Dr. Sarah Coles, family physician, Dr. Chana Davis, who is a geneticist and author, and Dr. Aparna Kumar, who is a psychiatric nurse practitioner specializing in pediatric patients. So welcome, you 3. Thanks for joining me today.
Thank you. Thanks for having us.
I have a very special guest appearance to make. Somebody who I know very well has some big news to share with everyone. Okay, that's your cue, hon. This is my son, Desmond Jones, and guess what Desmond just did?
I got my vaccine today.
You got your vaccine today! Desmond is 7. Do you want to tell everybody how it went?
It went great.
Yeah? What was the thing that surprised you about getting your vaccine today?
That I got it at Walmart.
Yeah, he got it at the pharmacy instead of at his doctor's office, which is where we always have gotten our vaccines before, right? Well, how did it go? What did it feel like?
It felt like something pinching me.
Tiny little pinch?
Yeah.
Yeah. How long did it take?
Not long.
Yeah, it really only took a second. And then after that, what happened next?
I got something.
What did you get? Oh, you got to go get it. We want to share. What is this?
This.
Oh, that is awesome.
Since we got the vaccine at Walgreens, of course, we had to shop in the Walgreens toy section and get this little stuffy, what's his name?
Uh,
I think you said chocolatey because he has a hot cocoa.
Oh, that's adorable.
All right. Thanks, Desmond, for sharing. I'm going to go answer everybody's questions.
Thank
about
you. Good
vaccines.
job.
Great job.
All right. He was very excited. Desmond does not love vaccines. He's a little bit afraid of needles. And so I was really proud of how brave he was. And we're going to talk a little bit more about vaccines and how to deal with needle phobias here today. So we want to dive right in with questions because we have a ton of questions to cover. But first, I would like to just have an overview of what the recommendation is, how we know that the vaccines are safe and effective for kids who are 5 to 7 years old. Chana, do you want to kick us off with a description?
Sure, yeah, I can describe the basic trial design. So all of the data on which these conclusions are based. So the trial started by taking a step back and figuring out what's the best dose for this age group. So they tested the adult dose and they also tested 2 smaller doses. So it was 30, 20, and 10 micrograms they tested. They were basically looking in a very small number of kids. That was 48 kids initially for the dose finding. And they were evaluating which dose, what does sort of the side effect profiles look like and what sort of hints of immune response can we see in that very small section of the population. So they decided to go with the smallest dose because it had the fewest side effects, but it still looked promising in terms of an immune response. So once they had that dose, then they recruited enough patients to do what's called a randomized controlled trial. That's the gold standard for making decisions because neither the patients nor the investigators know who's getting what. And so they recruited 1,500 kids initially to get the vaccine and half as many to get the placebo, with the intent being to compare the safety and the efficacy in those 2 groups. After input from the FDA, they recruiting another set of kids, another 1,500 kids to get the vaccine and another 750 to get the placebo. So the results that we'll be talking about incorporate a total of about 3,000 kids that got the actual shot and about half as many that got the fake shot and didn't really know which one they got. One more thing is everyone got 2 doses, and they were followed for safety for 3 months for the first group and then about 2.5 weeks for the second group, which they think would be long enough to detect myocarditis.
Right. Great. And Sarah, you want to follow up on that about the process for actually the recommendation that came in?
Yeah, so the process is the FDA reviewed the data that came out of this trial, and they recommended emergency use authorization for groups in this, for kids in this age group, which was then followed by the Advisory Committee on Immunization Practices, who meets as a CDC advisory group, who also reviewed the data and kind of all of the surrounding data about kids and COVID, and then come up with a recommendation for who should get the vaccine and when. And this was based on kind of the results of those phase 2 or 3 randomized controlled trials that Chana was talking about. So the trial itself found that the vaccine efficacy was about 90% to prevent symptomatic laboratory confirmed COVID-19. So remember, when we talk about vaccine efficacy, we mean it's a comparison between the number of people in the vaccine group who got COVID-19 and the number of people in the unvaccinated group who got COVID-19. So this means that there were about 90% fewer cases of COVID in the vaccinated group than the unvaccinated group, which is awesome, which is a really, really good vaccine efficacy. They also found that the antibody response was about the same for these kids as it was for adolescents and adults. So they had good, robust immune response to the vaccine, and that kids had very similar side effects to the vaccine as other folks who got the vaccine, including things like sore arm, feeling tired, headache, little muscle achy, maybe a little bit of chills. These side effects for kids were usually mild and lasted only about a day or 2 after the vaccine, and then just goes away without really having to do anything at all. There were no deaths, no cases of myocarditis or inflammation of the heart muscle, and there were no major bad events, like nobody needed to be hospitalized from the vaccine or had any serious disability or harm from the vaccine. I think one other really interesting thing that the ACIP, CDC, and FDA also looked at about this trial was that about 9% of these kiddos already had COVID before they got the COVID vaccine. And we know this because they had antibodies in their blood for COVID. So these kids did fine after getting the vaccine. In fact, they did really, really well. They had higher antibody responses than other kiddos in the trial, and weirdly and incredibly had fewer side effects to the vaccine than other kids. So this really tells us that the vaccine is safe and effective for all children, including kids who already had COVID.
Can I add something to this?
Of course,
you said that there were no serious adverse events related to the vaccine. I think it's important to note that there were some serious adverse events, but this does not mean they were related to the vaccine. So the investigators evaluate the severe adverse events. We saw them in both the placebo group and the vaccinated group, and things like a broken limb or eating a penny, you have to note that, but you have to make a judgment whether you think the vaccine caused it. And all of the serious adverse events, both in the vaccinated group and the placebo group, were not deemed to be related to the trial, and for good reason. You can see exactly what they were, and it makes perfect sense that there's no reason to think it was related to the vaccine. But that's just something we need to keep in our minds in general. Bad things do happen after vaccination. It doesn't mean the vaccine caused it.
Right. And in fact, it really cracked me up. There was discussion at the FDA meeting of the child who ate a penny, who was one of the participants in this trial. And that was deemed to be a serious adverse event, but not related to vaccination.
Exactly. Yes. It's an important distinction.
It is. Yes, it is. And it highlights that fact that what we're looking for is an increase in the rate of serious adverse events, because things do happen all the time. Bad things happen whether you're vaccinated or not, unfortunately. And so we look at an increase in the incidence of those kinds of events. So we're going to touch on many of those points in a little more detail as we go through here, including risks, benefits of the vaccination, side effects, vaccinating the dosage, vaccinating kids who've already had COVID. Lots of these things are coming up for parents all over. So we are going to talk about these individually. So I want to ask Sarah, can you follow up a little bit on this myocarditis issue? We have a question from Jessica from the Bay Area in California. She says, I think there's a legitimate concern among parents about the risk of myocarditis and pericarditis from the vaccine versus the risk of complications from COVID among this specific population. What are the rates of getting myocarditis or pericarditis from COVID-19 versus the vaccine?
And Jennifer, thank you for that question, because it's a really good question. And you're right, it is a legitimate concern that parents have, because of course you don't want something bad to happen to your kid's heart. So myocarditis is inflammation of the heart muscle, and pericarditis is inflammation of kind of that sac that surrounds the heart. And myocarditis and pericarditis can commonly happen after viral infection and very rarely happen after vaccination with an mRNA COVID vaccine like Pfizer. People who have myocarditis may feel chest pain, more tired, short of breath, or feeling like their heart is racing or skipping a beat. It's unpleasant. It's usually treated with medications and rest and gets better pretty quick, which is great. And is a very rare event after vaccination. But when it does happen, it's typically very mild, more likely to happen in boys aged 12 to 29, typically after the second dose and usually within the first few days after that dose. In the study we just talked about, there were no reported cases of myocarditis in kids aged 5 to 11, which is fantastic. And for kids aged 12 to 15, the rate of myocarditis after vaccination is estimated by the CDC to be somewhere around 20 to 60 cases for every million second doses that are given. And we expect the rate of myocarditis in this younger age group to be even less. On the other hand, we know that myocarditis is very common with COVID infection, 16 times higher, actually, if you get COVID infection than if you get the vaccine. So there's significant risk of myocarditis from just getting sick. So that's kind of what the rate of myocarditis looks like. It's very rare. And the CDC, the FDA, and healthcare professionals all agree that getting vaccinated is absolutely worth that risk. Since the pandemic started, there have been over 1.9 million cases, 8,300 hospitalizations, and 94 deaths in kids aged 5 to 11, which makes COVID-19 in the top 10 causes of death for kids in this age group, which is now a preventable illness, which is incredible. So vaccinations in these kids is estimated to prevent almost 60,000 cases, over 200 hospitalizations, 132 cases of multisystem inflammatory disease in children, which is a really big bad complication of COVID in kids, and about 72 admissions to the intensive care unit. And we know that the pandemic has been super hard on children, not just the risk of getting sick, but also worsening mental health, education gaps, decreased healthcare use, school closures, not able to play and socialize as much, and then the loss of their loved ones. So vaccinating kids is really important, and it's going to help us prevent spread to other people, help keep our schools open, and help people return to that normal life where they get to be around the people they love again.
Yeah, I think those are all really important points. Chana?
Can I add a little bit more to the myocarditis risk estimation? Because I love trying to put a number on it. I have kids in this age group and I want to have a number. So the trial had 3,000 kids and it didn't have any cases. So that tells us it's, for sure, no more than 1 in 1,000 kids, probably no more than 1 in 2,000 kids, right? So that you can say with great confidence. And beyond that, you're looking to what you've seen in other age groups for which you have bigger data, right? Just elaborating what you already said. So you can look to the rate in what's the highest risk age group in other kids, and it is boys around 16 to 17. And for them, they're on the higher range of what Sarah mentioned. So maybe about 50 to 60 cases per million. So let's call it 1 in 20,000 boys. So we don't think it's going to be, we think it will definitely be less than that. And the reason we think it's less than that is twofold. One is that myocarditis is known to have an age-related, even separate from COVID, myocarditis in kids is age-related, and it's lower with lower ages. And so that's one reason, just the baseline risk. And the second reason that came up in the discussions is because the dose is 1/3 of the dose. So in general, we're seeing fewer side effects in this group because they're getting 1/3 of the dose. So there are 2 layers of reasons to think it's going to be lower than what we have seen as the peak rate.
Yeah. And we have seen some debate about, the risks versus the benefits. And during the FDA meeting and the CDC meeting, myocarditis was the primary risk that was under discussion, because that is that has come out as a known risk of the Pfizer vaccine in other age groups. It's very, very small, but the debate comes because the immediate clinical benefits of this vaccine are also kind of on the small side in this age group, right? I mean, kids actually do pretty. Connection needs to be restored. I don't know what happened there.
We were like, we lost our host.
Uh-oh. Okay, am I back?
Yes.
Yes.
Sorry about that. I just dropped for a second. So I don't know where I dropped. I want to move on to the what are some of these benefits of getting vaccinated? Because a lot of people are asking this question, which is basically, why should we vaccinate kids when kids are at low clinical risk from COVID-19? And one example of this question that we received in our question box is that it came from Melissa from Evanston, Illinois. She asks, I'm kind of paraphrasing her, but she asks, why are we vaccinating healthy kids? Doesn't their immune system actually work better than the vaccine? And she adds, I have the same feeling about the flu vaccine, which misses the mark most years. If you're healthy, then you'll be fine. So why are we vaccinating kids? Aparna, you want to take this one?
Yeah, I'll take this one, and I'll leave a little bit of the immune system part. We're going to talk a little bit more about that later in the response of children's bodies to the vaccine. But there are so many reasons, both clinical and non-clinical, to vaccinate children. Protecting others is number one. Loss of work is number two, and getting kids back to normal, number three. So we know that vaccinating kids helps people get back to their lives. That includes us, our other adults, grandparents, teachers, coaches, pretty much anybody who comes into contact with a child. Some children are at higher risk, and they have had to miss out on school and other activities. Maybe their families are keeping them home, for example, due to any pre-existing conditions they have that place them at higher risk of contracting SARS-CoV-2 leading to COVID-19. Maybe they can't wear a mask for some reason, and so they can't be in school settings or other social settings, or maybe they have other issues which are preventing them from being around other children due to their health or other developmental reasons. In all these cases, having your child vaccinated and having more children vaccinated will help protect all of our children, and especially those who can't get vaccinated or have immunocompromise. And even if many people are saying, well, kids don't really get that sick. It's only so many. We talked about the numbers earlier. Dr. Sarah talked about it. But they can still get serious conditions. And that can happen even if they have mild illness. So even if a child has mild illness, they may still end up getting multi-inflammatory MIS-C, for example, which is most common, as just mentioned, in the 5 to 11-year-old range. They can also have long-term side effects. So we're learning a little bit more about what children can experience. Fatigue, headache, difficulty concentrating. Some people have called this long COVID in adults, or post-COVID fatigue syndrome, for example. And they can have insomnia and loss of smell, debilitating for a 6-year-old child. And we don't have a clear picture of how long these symptoms can last, but they can certainly be present. We can also think about when children do get sick. So suppose your child gets sick and has mild illness. What does that mean for your child, and what does that mean for you? How long will they be out of school, and how long will you be out of work? Having them vaccinated helps minimize that risk and also helps you get back to work. So less disruption in the workplace. We also, getting kids vaccinated also helps them get back to normal, as Dr. Sarah mentioned. So getting them back to sports, activities, social gatherings, interaction with family. When we talk about children, we talk about routine, and schedule as probably the most beneficial things to ensuring good mental wellness. And lastly, I'll just say that having children back to their routines helps all of us, because it helps us maintain our routines, and it helps us maintain our own mental wellness. Finally, I'll just say one thing, that many children have also lost a parent or loved one or a guardian or important adults in their life. Up to 175,000 children in the United States alone is estimated. And this is really difficult to imagine. And by getting your child vaccinated, you're also preventing the important adults in their life from potentially having COVID-19 and severe effects. So those are just a couple of reasons outside of the direct clinical impact to your child that it can be beneficial.
Yeah, yeah, absolutely. I think the broader view of impacts makes the balance there really clear. And I think the debate, when the debate comes up, is probably missing some of those really critical non-direct clinical impacts, right? So, Aparna, we're also getting a lot of questions about side effects. And for example, Elena from Houston, Texas asks, I plan on getting my 6-year-old vaccinated as soon as it's available to her. And she saw the data that Pfizer provided. She says it looks pretty darn good to her, but she was trying to get an idea of what to expect. She says, my second dose of vaccine knocked me on my butt for a couple of days. Were similar things seen in 5 to 11-year-olds, or are vaccine side effects very mild? And Aparna, I know you're actually doing vaccine clinics, giving vaccines, and so I thought maybe you could answer this one.
Yeah, I'd love to answer this. So just as background, I'm a nurse and I have been giving COVID vaccines. I'm sorry, I'm trying to get my angle right here. I've been giving vaccines since December of 2020 and have probably given hundreds and hundreds of vaccines over time, either myself or with our students at the Jefferson College of Nursing. So I have seen many people get vaccines. I have seen very few immediate side effects that have required medical attention. And I've seen a few urgent things that have happened that have not ultimately been serious. What you can expect for your child is very similar to what you had yourself, but milder. Remember that, and we have little voices to guide us through that in the background somewhere. Remember that children are, as Dr. Chana pointed out, are receiving 1/3 of the dose. We know that children overall are having fewer side effects, but they can be very similar. So pain at the injection site is the most common side effect, then fatigue, headache, muscle pain, and chills. And as Dr. Sarah mentioned, typically resolving within a few days, slightly higher for the second dose. So as long as you're preparing yourself for those side effects that your child will experience and preparing them as well, that is the best way to prepare for the potential side effects, as well as making sure you're drinking plenty of water before you get your vaccine, you're well rested, and you know what's going to come, which we'll talk about a little later.
Yeah. Great. Thanks for that. And I just dropped in the chat there in case you didn't figure that out on your own. Dr. Aparna is also a mom with a kiddo in this age group. So you could hear that in the background. We have a link to share from the AARP that's directed at grandparents, and it's about vaccine side effects in children and what to expect. It's really a very good link. Okay, so let's turn to the next topic. We have had so many questions about dosing. I don't think I quite realized how hard dosing for vaccines is to understand until kids' vaccines started rolling out, and parents have so many questions about this. So Chana, you have children at both ends of this 5 to 11-year-old range, and I know you've been paying close attention. I think you're going to ace this one.
Oh, yes, I do. So I have twin girls that are 5, and I have a boy who's going on 11, and he's fairly large size. So I can speak to some of the questions about what if my kid is kind of on the cusp, and why should I trust this dose?
Yeah. So this question comes in several different parts, and we're going to tackle part 1. Why is the kid's dose so much lower? How do we know that this is enough? And one example came from Michael from Connecticut, who asks us to give an explainer about this plan to use 1/3 of the vaccine dose for these kids. He says, as a layperson, it is hard for me to understand how science could justify that an 11-year-old only gets 1/3 as much as a 12-year-old. It seems like either one dose must be too high or the other one too low. And then the kind of implicit question there, I think, is really, does this lower dose decrease the vaccine effectiveness to some extent?
Yeah. Well, I want to take a step back first and talk about how vaccine dosing works in general, because the COVID vaccine is not unique in that there's some dose tailoring based on age. They're actually tailoring the COVID dose more closely than many other vaccines. So what we're used to thinking about as parents is, looking at that bottle of Advil and looking at your child's weight and figuring out the right dose. I mean, that's kind of what we're all used to. And so just the same way, with regular medications, just the same way, someone who's tiny feels a drink much more than someone who's huge. the reason that's true is because the medication has to spread throughout your body to have its action. For vaccines, what matters most is basically how potent your immune response is. And as we age, our immune response tends to kind of dampen. And I sort of like to say that just the same way you have to kind of yell in your grandma's ear to hear you, you kind of have to do the same with the vaccine, like, hello, I'm a foreign body, attack me. So with kids, we don't need to, we can just whisper, the whisper of the vaccine. So that's what they're trying to do with the trials. They're trying to find out, like, what's the quietest little whisper we can give to this little body to alert it that there's a foreign body and to generate that immune response. And the reason you don't actually need a lot and why the actual size of that person doesn't matter is because the vaccine reaction basically happens largely at the site of injection. So when that foreign body is, the mRNA enters your body, it enters your cells, those cells start making that little tiny piece of virus, and then immune systems will flock to that site. And immune systems, they all send signals to each other. So they all know there's a party at the injection site, and they're all going to come there. The vaccine does not need to spread throughout your body to generate an immune response. So that's kind of two aspects to it. That's sort of addressing why does age matter and why does size not matter. So in fact, this vaccine is, like I alluded to, this vaccine is actually being tailored more than other vaccines, and it's not unusual for babies to get the same as other children. So there is a lot of context for that. It's also not unusual for adults to get a bigger dose because they need a little bit more of a yell to hear that something foreign is in their bodies. So back to the question, you know, sort of the original question had two elements to it. One is, you know, did the 12-year-old get too much or did the 11-year-old not get enough, right? So the first part, did the 11-year-old get enough? Is a third enough? We know the answer is yes, because of what Sarah talked about from the top line results of the trial. We know these vaccines provided the protection, 90% protection from infections, or 90% reduction in risk of infection. And we know that the vaccines were well tolerated and that the side effects, both short-term, both sort of like local and systemic, were minimal. So that's what we want a vaccine to do, and it achieved that. So we definitely know the dose in the 5 to 11s was right. Now, the other question is, did the 12-year-olds therefore get too much? They didn't get too much because same thing, look at the trial and look at the trials in the 12-year-olds, and we see that they get a good immune response when they don't get too much. They get good protection and they don't get too much in terms of side effects. I would guess that the 12-year-olds could have gotten away with a lower dose. But it's not really, like, dosing with vaccines is not really linear in that twice the dose gives you twice the protection and twice the side effects, right? So we don't really know what would have happened. They probably could have gotten away with a slightly lower dose, but the dose that they do have is fine and it is safe and it works. So let's just go with what's been well tested. That's how I think about it.
Yeah, and just to follow up on that, when we think about how a vaccine works, most of the action is actually your body, as you just said, but I just want to reiterate that. The dose in both this 10 microgram dose that the 5 to 11s are getting and the 30 microgram dose that kids 12 and up and adults are getting, that is a very, very, very small amount of an active ingredient, right? A microgram is 1,000th of a milligram. And we're used to dosing things like ibuprofen in milligrams. Okay, so we're actually talking about like incredibly tiny amounts of an active ingredient. All the action happens because your own natural immune system is responding. And so, you know, the dosing is just about optimizing to make sure that response happens. So Chana, I want to give you a break. I know you wanted to answer this next question about waiting for 12-year-olds, but I want to just give you a breather. Sarah, do you think you can tackle that one? Or are you not ready to tackle that one?
No, sure. That's totally fine.
So what do you think about this question? And then we'll come back to you, Chana, for about the little 5-year-olds. From Melissa from Maryland, who says, my 11-year-old will soon turn 12 in January 2022. Would it be better to wait until he's 12 to get that adult Pfizer dose or protect him earlier with the smaller dose?
And feel free, other folks, to weigh in, but my answer is no, don't wait. Do it now. We know that the dose is safe and effective for your kiddo at 11. The trials are really good and solid. There's not a significant benefit in waiting, but there is a significant benefit in getting that protection right now. So go for it. Go ahead and get that 11-year-old vaccinated.
Yeah, anybody want to add on to that?
I'll just add in that we did see guidance come out from the American Academy of Pediatrics. So what happens if your birthday is between doses? And they said to go with the lower dose for both.
For both.
Yeah.
Lower dose now for your nearly 12-year-old, and then after they've turned 12, second dose should also be the lower dose.
Yeah. I presume that's because there's a marginal, you're not going to get, like I said, you're not going to get triple the protection by tripling the dose, but you probably will get more side effects.
And I will say the CDC disagrees. So the CDC says to get the dose that's appropriate for your age on the day you get the vaccine. So if you're 11 for dose 1, you get 10 micrograms, and if you're 12 for dose 2, you get 30. So my suggestion is talk to your clinician, talk to your primary care doctor, and find out what you think is in the best interest for your kiddo.
Yeah.
I don't think either of those is a bad decision, right? It's like you can make a case for both.
Yeah, which is why you see two well-respected organizations coming to different conclusions there. Science in action, people. From the perspective of epidemiology, from my perspective, the problem with delaying is that you are at risk for some number of months. And that delay those are just days at risk that you're adding to the total days of risk in the population. This turns into actually a pretty big problem at the population level when we see people spacing out their childhood vaccination schedule. It adds up to a lot of additional months at risk, which are not contributing to herd immunity. So sooner is better from the population perspective as well. Okay, let's go back to Chana for the last in the dosing series here. What about that tiny 5-year-old? Laura from Bloomington, Indiana has a tiny 5-year-old, 38 pounds, and she wants to know, how can I feel confident that he needs the same dose as an 11-year-old?
Yeah, that's a perfect question for me. My twin girls are just over 40 pounds. So these are same situation for me. And I will not hesitate to give my children the recommended dose. It's really about, we could talk about earlier, it's about your immune system's maturity. And, it's just like a smaller child is no less mature, or a bigger child is no more mature. It's about, how is your immune system going to respond? And that doesn't depend on your body size at all. So since this vaccine has been tested in that age group, some of the trial results were broken down by age, and there wasn't any noticeable age effect in the range of 5 to 11. So there's no reason to think it'll be, better or worse in 5-year-olds. So I'll definitely be vaccinating my girls ASAP.
Right. Yeah, and I know you're in Canada, so that's not as soon as the rest of us.
ASAP is not as soon as it is for you, unfortunately.
Yeah, I'm sorry about that. And for the rest of the world, it is also still waiting here.
Yes. Yeah.
Okay, next up, co-administering with other vaccinations. We're going to go back to Sarah for this question again. And the question comes from Allison in New York. She wants to know, is there any value in staggering kids' annual vaccinations with their COVID shot? She has an almost 11-year-old who usually spikes a fever after a vaccine, and he's due for his Tdap soon, and maybe also HPV. I mean, I don't know what he's due for, but that's another of the 10-year-old vaccines. I want to get the COVID shot as well. CDC says that it's safe to get both during the same visit, but is there any reason to wait?
So I take care of kiddos in my office because I'm a family doctor, and what I am telling folks is go for it. Get the shots all at the same time. Just get it over and done with. There have not been any safety concerns when giving multiple vaccines at the same time. This is actually something we do a lot, all the time, right, with both kids and adults. And the immune system can absolutely handle it. There is some fear that you might overwhelm the immune system, but that's clearly untrue. Our immune systems are amazing and handle way more exposure all the time than just the tiny amount that we're giving them in just one or a few vaccines. It's definitely more convenient to just get them all at once. You don't have to go back, make a separate trip or a new appointment. My personal feeling is I'd rather have a fever once after a handful of shots than get a fever multiple times after I get a series of shots. And the downsides to getting multiple shots at the same time is pretty small. Mostly would include you might be You might have soreness in a couple different sites if you get vaccinated in different sites, which would be recommended for older kiddos. And maybe you get a few more of those reactogenic side effects, so things like fever, headache, feeling tired. And if you would prefer to pass, like you prefer to space them out, that's okay. It's not contraindicated, meaning it's not allowed. But it's a really good idea to have a plan in place for when you're going to get those next shots so you don't slip your mind. So have it scheduled, have your next appointment ready if you decide you want to space them out.
Okay, great info. So some more practicalities up next here. Aparna, I know this is really one of your areas of expertise, and it's an area that we worry about because, you all met Desmond at the beginning. He has a little bit of needle fear. So how do we deal with a kid, help a kid through this when they have needle fear? And I think especially, and at least for my kid, COVID-19 has been such a big deal for such a long time now, like actually a pretty substantial fraction of his life. And so in his mind, this vaccine is like bigger and worse than the other ones even. And he's already afraid of the other ones. So what are your tips here?
Yeah. So one, talking about it. That's going to be the number one thing, and in a way that's non-threatening. And I'll go through kind of a couple of tried and true tips. A lot of these come from our Children's Hospital Philadelphia website and my awesome psychology colleagues there. So can't take all the credit for these, but I will put them out there. So tell your child what is happening. Do not surprise them. Do not say we're going to get ice cream and then go get them vaccinated. Tell them what to expect. It sounds silly, but people do it. It sounds silly, but tell them where they're going, what is going to happen. There's a great video, Sid the Science Kid gets a vaccine or gets a shot. And you could take a look at that, even though it's not specific to the COVID vaccine, and watch it and prepare your child. And there are many others on YouTube that you could take a look at. What is it like to go get a vaccine? And children know because they get so many vaccines. They know what it is to get a vaccine. What they may not be prepared for is the actual site. So as you mentioned, Malia, getting a vaccine at a pharmacy or at a store or at a high school or wherever else.
It was really funny because I get most of my vaccines at Walgreens. He was like, why are we in the grocery store?
Why am I standing in the aisle getting
He's like standing in the aisle next to the sodas and like, what is happening?
Yeah, exactly. So let them know, prepare them for all of those things. For children who are a little more anxious, they might need a little more detail. Some children will be fine with, we're going to get your vaccine at this place. Others will need to know, well, what will happen when I get there? How long will we be there? How long will I have to wait afterwards? And then outside of that, make sure you're using the right terminology. So a shot sounds super scary to a 5-year-old. Like, what's a shot? Use injection, or there will be a needle in your arm, or a vaccination or a vaccine, whatever term they understand that is the right an appropriate term, and avoiding things like saying you're just going to have a little boo-boo on the arm, or just use the right language and describe it as you would in age-appropriate language. Practice what you're going to do especially for anxious children. Practice being brave yourself. So as I said earlier, whatever we do is what our children kind of pick up on. So taking a good, nice, tall stance and looking like you're not worried about things. You might want to practice that yourself in the mirror and then practicing it with them. It's fun for kids to practice being brave. Maybe having a catchphrase, writing it down for your child. You can put it on a card, or they can write it on their hand, or if you're okay with them writing on their leg, whatever. I can do this. I'm helping my family, helping my community, whatever might kind of stick with them. If they have a true needle fear, you want to gradually introduce the idea of needles. Like I said, watch videos, watch them a lot. And just to put it very simply, the more you watch it, the less interesting it becomes. So it's boring, and you can't be bored and anxious at the same time. Like it's never happened to me. Like you're alert when you're anxious. So pair another good, I'll continue. So pairing the shot with a reward. So I think, Malia, you did a great job with that. So you get the squishy animal thing and whatever else. A lot of our vaccine sites are giving little candies, cool Band-Aids or stickers, whatever, the kinds of things you get when you normally get a vaccine. Some places are doing freezy pops or whatever because they, whatever they have. But if they don't have that, maybe you want to talk about something. It doesn't have to be something you buy, but it could be, we'll go to the library, we'll spend more time together, we'll take a day off, whatever appeals to your child. Again, it doesn't have to involve buying something. Bring some comforting things. So if they have a stuffy or a blanket or whatever will make them feel comfortable to be there. A lot of sites have things that make children more comfortable, like these little bumblebee things you may have seen. They're called buzzies. They stick them on the arm. They're going cold and distracting from getting the vaccine, and makes it hurt less a little bit because it's a little pressure and a little cold. But if you have other things that will make your child, so some kids have little fidgety things or squishy things, that can help too. Set yourself up to do your best. I talk a lot about this on Dear Pandemic. Make sure everyone sleeps enough, eats. The number one thing I saw when I have been vaccinating people is people are fainting because they haven't eaten breakfast or had anything to drink all day. It's not because of the vaccine. So it's, make sure you do all those things. Give yourself plenty of time for your child so that when you get there, you're not rushing around and creating, more anxiety in this situation. And remember that after, a lot of times people think right after they get the vaccine, they're done, they're out. Remember, you'll have to wait for 15 minutes at least. And you might want to ask what the site is going to be like for that purpose. If your child is one that some children like to lay down, you can have your vaccine laying down. So believe it or not, we've done it. And so for some people that are afraid they're going to fall or pass out or just would be more comfortable, you could bring a yoga mat and do that. But you just want to be prepared if you might need that. Be prepared with anything else like a long wait, snack, etc. And then praise your child. Lots of praise afterwards because they will need to come back for their second dose. So you want to make that first dose as pleasant an experience as possible.
Yeah. I told Desmond that we were going to go get ice cream after his shot.
After the 15 minutes after your shot. Yeah,
exactly. Yeah. And I made a lot of other promises a long time ago about what would happen after the kids were vaccinated. Like I said, we would go to the Dells, which is here in Wisconsin. It's kind of like Sandusky, Ohio or something.
I've been to the Dells.
Yeah. And I said we would go to Disneyland, and I said they would all have sleepovers, and I said all sorts of things. And so one of the things I
probably wrote them down, and every week they're going to bring them up. Yeah.
At the time, those things seemed so far away. I figured anything was possible. But actually, one of the things we've been having to do is some adjusting expectations because I think he thought that we would go get vaccinated and then go to the Dells, leave from the Walgreens to the Dells.
Did you pack his bag?
Yeah, so we had to do a little expectations on that one too. Okay, so let's move on. We just have two more questions that I'm going to take today. Carolyn, who didn't tell us where she's from, wants to know, how should I be thinking about the importance or the utility of vaccinating a kid who already had a mild COVID infection? Is there some kind of optimal timing? And Chana, I think you wanted to take this one.
Mm-hmm. Yeah, I wanted to build on what Sarah said earlier, that there were children in the trial. About 9% of the recipients had previously had COVID, and they had even better immune response. So their antibody levels were boosted substantially by getting the vaccine. And it was shown to be safe. They actually had fewer side effects than the children who had never had COVID. I thought I might add a couple of numbers onto that. So for example, redness at the injection site was about 1 in 5 for kids who didn't have COVID previously, but half of that for kids who had previously had COVID. Swelling at the injection site, again, it was half as common, 1 in 6 if you had never had COVID, and less than half of that if you had previously had COVID. Fever dropped from about 7% in kids who had never had COVID, and down to 3% in those who had had COVID previously. Same with fatigue, dropped a little bit from 4 in 10 to 3 in 10. So a lot of side effects. These are the numbers I'm citing are primarily after the second dose. So a lot of substantial reduction in side effects on the second dose. And so, yeah, as far as I know, there is a consensus amongst experts that if you have been previously infected, you should still get vaccinated. And it's the same reasons as for adults. We know it's safe. We know it's effective. Natural. Actually, a lot of people don't like the term natural, but getting your immunity from the virus produces a less consistent and reliable immune response than getting your immune system primed through a vaccine, because you know exactly what the exposure was. So we know you're covered if you get it from the vaccine. We don't know for sure how well you're covered if you got your immunity from the virus. So that's and there's a clear agreement on that. So there's no reason to even bother asking or doing a test. Did my kid already have COVID or not? Just go ahead and get it and get both doses, because both doses were tested in the trial.
Yeah. Sarah, do you have anything to add there as a clinician in practice with kids? What's your recommendation?
Yeah, I absolutely agree. If your kiddo has had COVID in the past, they still should get vaccinated. I would still strongly encourage vaccination for that child. A lot of questions will come up about when should I get it? So if my kid had COVID, how long do I need to wait? Do I need to wait? There's no minimal interval you have to wait between having COVID and getting the vaccine, other than they need to no longer be contagious and sick. So they should feel better and be at least 10 days out and 24 hours without feeling really lousy in order to get the vaccine. So after that, at any point, go ahead and get it. Do it what's based on what's right for you and your family. The longer you wait, sometimes the more likely you are to forget. So go ahead and get that vaccine.
Yep. Okay, who wants to ask me this last question?
I do. I have a question for you, Malia. There's a lot of really appropriate wondering about when are the littles going to get it? So how about those kids under 5? When do we expect to see vaccines for them? And Denise from Babylon, New York actually says, to the 4-year-olds who wants it now. So when can they expect to get for their kiddo under 5?
Yeah. Well, I checked with my crystal ball and the answer was a little unclear, but I think we can make some pretty good guesses here. And my best guess is that Pfizer will be filing for an emergency use authorization in early spring of 2022. So that could be like January, February 2022. And as we've seen, the process moves quite quickly once they have data available. And then I think it's not likely to be before late spring or early summer for the kids who are 6 months to 2 years old. Pfizer is in trials in these younger age groups right now, and the trials are underway. And they're saying that they expect to be releasing data sometime around shortly after New Year's. I think something that we learned was that for these 5 to 11 vaccines is that the FDA meeting, the panel did focus pretty narrowly on direct clinical benefits versus risks of the vaccine. And so the Pfizer's going to need to show some very robust safety data to reassure the expert panel, the committee, that these, like we said, the individual direct clinical benefits are actually pretty small for this age group. A lot of the benefits accrue because of things like we can interact socially. We don't have to miss school when we've had an exposure and so forth. So those are not direct clinical benefits, and FDA is really not considering those benefits. Which means that Pfizer's just going to have to make a really strong case about the safety and the relative advantage of being vaccinated here. And I think that could slow things down a little bit. They're just going to want to be really sure. And that means, could mean enrolling more people. It could mean taking a little bit longer to prepare the report.
I can't remember, Malia. Is it the same? So sorry. Question. I can't remember. Do they have the same dose for the littles? Or did they bring it down again? I think I know they tested.
They tested even lower doses, but I do not
remember
know
what they settled on. Yeah.
What they settled on. I don't remember. I could look that up and post about it later. Anybody else know? No.
Yeah.
So Moderna is also in trials for younger kids, 12 and from age 6 months all the way up to age 11. they've been kind of cagey about a timeline. I know that their trial design, the design of the study, was more complex and involved a bunch of testing different doses at different age groups before they could move forward with the next phase. And so I imagine that's probably what has slowed Moderna down a bit. J&J has not even started trials in people under age 12. They're currently testing in that older age group. So the first one that will become available is very likely to be Pfizer. And my guess is not before, January, February 2022, maybe even a little bit later than that. So yeah, unfortunately, a little bit longer to wait, but at least those school age kids will be covered and hopefully passing less virus around at school.
I just did a quick Google and it looks like 3 micrograms.
Oh,
But
it
we
is
can-
lower. Okay.
Yeah.
So
6
even
months.
lower.
Oh, that's for 6 months. That was for 6 months to 2 years.
Okay.
Yeah.
And
That's
then
for
the
6
2 to 5s are I sort of
Yeah.
remembered that they were 10 micrograms.
Yeah, I think so, but we should confirm.
Yeah. So that's all we have time for today. Thanks so much for joining me, all of you. And I want to just put a plug in for our newsletter. If you want to get twice weekly updates about what Dear Pandemic has posted about most recently, you can sign up for our newsletter on our website. That's at dearpandemic.org. And we're doing these live Q&As on an occasional basis at this point. You can put your questions into our question box, which is on our website, and we will use those to decide what we're going to be posting about in the upcoming weeks, as well as if we kind of get a whole bunch of questions that are all on the same topic like this, maybe we'll do another Q&A. So that's all we've got. Thanks for joining us, and until next time, stay safe and stay sane.
Bye.